Rapid Diagnostic Kits, RDKs. Rapid Diagnostic Kits, RDKs, play a crucial role in the diagnosis of various diseases, including malaria. Malaria is a life-threatening mosquito-borne disease caused by Plasmodium parasites. RDKs, for malaria, are designed to detect the presence of these parasites or their antigens in a patient's blood sample. These kits are simple, easy to use, and provide rapid results, making them invaluable in areas with limited access to laboratory facilities. The most common types of RDKs for malaria are based on immunochromatographic assays, commonly known as rapid diagnostic tests, RDTs. RDTs detect specific malaria antigens such as histidine-rich, protein 2, HRP2, Plasmodium lactate dehydrogenase, pLDH, or aldolase, depending on the specific test. Here's how a typical RDT for malaria works. 1. Blood sample collection. A small amount of blood is collected from the patient using a finger prick or venipuncture. 2. Test procedure. The RDT kit typically contains a test strip or cassette with specific antigen detection zones. The blood sample is applied to the designated area on the test strip or cassette. 3. Migration. The blood sample migrates along the test strip through capillary action. 4. Antigen detection. If malaria parasites or their antigens are present in the blood sample, they will bind to specific antibodies immobilized in the detection zones of the test strip. The detection zones are usually labeled with colored particles or enzymes. 5. Result interpretation. The appearance or absence of colored lines or other visual indicators on the test strip indicates whether the test is positive or negative for malaria. Most RDTs have a control line that confirms the test is working correctly. It's important to note that RDTs have different sensitivities and specificities depending on the target antigens they detect. Some RDTs are specific to certain Plasmodium species, such as Plasmodium falciparum, which is the most common and severe form of malaria. Other RDTs can detect multiple species. RDKs for malaria have significantly improved malaria diagnosis and have been instrumental in providing timely treatment, particularly in resource-limited settings where access to laboratory facilities is limited. However, it's important to note that RDTs are screening tools and should be followed by confirmatory laboratory testing in cases where malaria is suspected, but the RDT result is negative or inconclusive. It's always recommended to consult healthcare professionals or local health authorities for the most up-to-date and accurate information on malaria diagnosis, including the availability and proper use of RDKs in your specific region.